Today marks the second anniversary of the first U.S. laboratory-confirmed case of COVID-19 in the U.S. Since then, a pandemic has swept the globe and is still with us today, with the Omicron variant the latest incarnation of the virus that has changed the world as we know it. Joining us now to look at where we've been and what we've learned are Dr. Emily Landon, Executive Medical Director for Infection Prevention and Control at UChicago Medicine, Dr. Maximo Brito, an infectious disease specialist and a professor at UI Health, and Judith Allen, a psychologist who is clinical director and COO of Communities in Schools of Chicago. Thanks so much to all three of you for joining us again. Dr. Landon, let's start with you, please. 2 years. Could you have predicted, did you expect that this would be 2 years in, 2 years ago?
When I first was approaching COVID, it didn't even occur to me to think about the duration that this was going to last, to be perfectly honest with you. I wanted to get through whatever was happening at the time, and each day felt like a year, and each week felt like an eternity. So it wasn't really a thought that crossed my mind. I hoped that this would pass through and the cases would come down, and we would then be able to figure out where we stood. Now I look back on that and I realize that was very, very unrealistic. We were always going to have a respiratory virus pandemic was always going to be tough to handle and was always going to take more than one wave. I didn't necessarily explicitly think it was going to be short, but we also didn't really message very well that that was going to be that it was going to be long.
That it was going to be long. Okay, Dr. Brito, a lot can happen or change in 2 years. What do we know now that we didn't know 2 years ago?
Well, we know that the virus mutates, and we kind of suspected that going in, but its ability to mutate and to turn into a complete different pathogen, I think it came as a surprise as people, especially since after we had the vaccines, which we thought were going to really be the beginning of the end of the pandemic. And we've learned a lot of stuff. We learned therapeutics right now. With impressive speed, we've created therapeutic agents that are able to treat the virus. And there's vaccines that, even though we have seen breakthrough infections, like especially with this wave of Omicron, we know that they're very, very effective in preventing hospitalizations and deaths.
Judith Allen, we know that the pandemic has disproportionately impacted communities of color, exposing a decent amount of inequities that exist. Have we gotten better in these 2 years at addressing the racial inequities that we learned about?
I think we've gotten better about acknowledging the fact that we have those inequities to begin with. I think at some level there was a point of sort of almost a quiet denial, right? It's like we're okay. And we saw a lot of that really began when we had to get kids laptops to take home. Great, they have a laptop. Do they have Wi-Fi? Do they have a room where they can actually get some homework done? So what this did is it opened a lot of windows that we're now having to make sure that we're putting screens in those windows and make sure that things aren't flying in the faces of all the work that we've done over the course of the last 2 years.
Today, President Biden addressed the nation as he also marks a year in office. He spoke about defeating the virus. Here he is.
I'm not going to give up and accept things as they are now. Some people may call what's happening now the new normal. I call it a job not yet finished. It will get better. We're moving toward a time when COVID-19 won't disrupt our daily lives.
And of course, what everyone wants to know is, when is that time? Dr. Landon, I know you can't predict the future, but a year ago, we thought that life would be back to normal, in late 2021. It obviously hasn't happened. What's next? How do we get out of this?
Well, we need to have global vaccination. We need everybody in the entire world to be able to be vaccinated. We also need to acknowledge that this isn't going to go away easily and that we're going to need to do things in order to protect healthcare and to protect vulnerable individuals when it does flare up. And that means not just throwing the baby out with the bathwater and saying, oh, I don't want to do that anymore. I'm done with COVID. I'm going to ignore it now. We have to acknowledge that it's there, and we need to put our masks on and trudge through things and wait for the wave to subside and then get back to normal as quickly as we can. But without those non-pharmacologic interventions and widespread vaccination, and then the new medications need to be widely available. The new oral pills need to be widely available, especially for vulnerable individuals. Those three things together are going to really make a big difference for us, but we're not going to be completely free of COVID. We're always, for many years, we're going to have to take additional measures. And the faster we're going to feel better about it is going to happen when we accept it.
Judith Allen, census data, well, and we don't even need the census data. We know that mental health needs were exacerbated by this pandemic. How should we manage this sort of collective increase in mental health needs that'll result from this pandemic?
Right. I think over the course of the last 2 years, again, it was about our adaptability and our ability to sort of pivot. I'm actually tired of using the word pivot, but it was really about us having to learn a different way of operating. And that meant, behaviorally, mentally, environmentally, psychologically, how we answered, how we addressed conflict. This is especially true with our children. Kids are incredibly resilient, right? But this has really tested their immunity, no pun intended, and their grit. So their ability to kind of bounce back. So I think the lack of structure has been very difficult for kids and adults alike. And we've also have to make sure that we're not minimizing what children are going through, because in the same way that we're experiencing these stressors, so are they. And so we need to put a little bit more onus on see something, say something.
Dr. Brito, as we enter what will be the third year of the pandemic, new variants are expected to prolong it, obviously. What is the likelihood that there is another variant, that comes along and we don't see the end?
Yeah, well, there's a high likelihood that we're going to have variants because this virus mutates. We know it's a respiratory virus. There are a lot of people who are still unvaccinated. So the potential for mutation is there. And so they're going to start appearing. However, there will be a point, and I want to strike a chord of optimism here. I mean, there will be a time when the disease will become endemic. And then we will have those variants like we have it with influenza. These viruses change every year. And then we change our strategies to prevent it. So we use vaccines that are different from the year before. And that's exactly what's probably going to happen here. As Dr. Landon was saying, we don't know exactly when that's going to happen. And that's why we need to continue the mitigation strategies. One thing that is different this pandemic from other pandemics and from influenza every year is we had the versatility of the mRNA technology in which we can produce very quickly vaccines against different strains. And so when we come to an endemic stage, I think we will be using vaccines, perhaps in a yearly basis, and then the disease will become part of the background of diseases that we see every day, and we will be able to resume our lives. We're not there yet, but we're closer than we were in 2020.
I'm sure everybody appreciates the optimism. About 30 seconds left. Dr. Landon, any silver linings out of this?
I mean, we're going to emerge from this Omicron wave with more, at least short-term immunity than we had before because so many people got sick and are still getting sick with Omicron. That's going to be really helpful for us. And I'm hoping that if there's not a new immune escape variant coming our way, and I'm crossing my fingers and praying and doing all of the throwing salt over my shoulder that it doesn't happen, it looks like that could be a really nice spring and summer for us when this disease doesn't circulate as aggressively in our part of the country.
All right, here's hoping, a whole lot of hope. My thanks to Dr. Emily Landon, Dr. Maximo Brito, and Judith Allen for joining us.
Thank you.
Thank you.